making a difference to the animals that I look after and the people that look after them is really near and dear to my heart. Some days are rough with sad endings, but most of the time it's just really enjoyable and such wonderful work and a real privilege to be able to do.
And meet the rest of the amazing team. Sue, Co-ordinator and ARRC's Angel. Dr. Tara, Assistant Vet. Emma, Senior Vet Nurse Extraordinaire. Karen, Vet Nurse Extraordinaire. And Kerri, Receptionist and IT Queen. It's another busy day in the life of the Holistic Vets and ARRC team. It's only 9 a.m. and Dr. Lisa has already finished a radio interview, tended to hospitalised animals and injured wildlife that is constantly arriving at the front door. While reception continues to fill up with people coming from near and far, Dr. Lisa has patients already in the consult room waiting for her. Meet Saf, a much-loved dog of 14 years old who's been through the mill. Run over by a car almost a year ago, had a large tumour removed from her stomach 6 months ago, and recently fallen from a car. This poor girl has had a journey. Dr. Lisa checks Safi over and talks with her owner.
In case if you were going to
Sure.
give her an x-ray, I just thought we might just pay and...
Absolutely, no worries. Okay.
While Saf is getting prepped to have x-rays done to determine the extent of her injuries, Lisa checks on Pisa, an adorable cat that was hit by a car and has been left with a broken pelvis and paralysed from the waist down. Due to nerve damage, she's unable to urinate and defecate on her own, which is concerning for her long-term survival. With such severe injuries and after consultation with a specialist, Pisa's local vet had recommended euthanasia as an option. But with her front half being so perky, her owner looked for other options and consulted holistic vets.
Pisa's case presents some really difficult challenges. She's come to us having had 2 vets suggest that euthanasia might be the best option for her, yet her owners can't reconcile that her front end is so bright and happy and her back end doesn't work. As vets, our duty is to relieve pain and suffering, and when we're faced with a decision of euthanasia, we've got to weigh up very carefully what's in the best interests of the animals. But for Pisa, I can see that she's not suffering at this stage. Certainly she's got a lot of healing to do, but she's coping really well. And there is a chance, even if it's small, that she might pull through, and if not live a normal life, at least she could live as a handicapped animal being looked after really well by her owners who are up for this challenge. So we've got an interesting few weeks ahead of us, and while some animals have done remarkably well with the therapies that we offer, like our amazing hyperbaric chamber and acupuncture and various other things that we use, and they've come back with health conditions where they've been told before by other vets and specialists that there's no chance, Pisa might not be one of those, but we'll certainly give it a really good go.
Dr. Lisa hopes that with acupuncture and hyperbaric oxygen therapy to help flood her cells with oxygen and promote healing, there might be a chance of restoring some function to the lower half of her body, or at least help to accelerate the healing of her fractures.
Now I've got Pisa in our hyperbaric chamber, and she's about to have a session of hyperbaric oxygen therapy, which basically means getting oxygen at high pressure. Oxygen under high pressure is amazing because it delivers very high concentration of oxygen to all the cells in the body, and it can actually bypass the bloodstream, which is incredibly helpful when there's been traumatic injuries. And of course, every cell in the body to function optimally needs oxygen. So after her chamber session, Pisa will feel nice and relaxed. There'll be some anti-inflammatory effects, and most important, it will help her fractures to heal at a greater rate, and we're hoping that it will also help to regenerate some of her nerves, but time will tell.
While Saf is being x-rayed, a woman brings in a stray kitten into reception that was found on her driveway. We'll check in on her and find out what state the kitten is in after the break. Saf is safely coming around from her sedation and waking up bright-eyed and bushy-tailed. This 42 kg gorgeous girl is carried to her recovery area.
Anal glands can be a messy business, but sometimes it can be wonderful to help to relieve an animal's discomfort by giving them a good squeeze. A lot of the time, animals that chew their paws or drag their butt on the ground or nibble constantly at the base of their tail, they're trying to indicate that their anal glands are full, and they don't always express normally. So one day I was out at this farm checking out some animals, and my client asked me to check out her big Rhodesian Ridgeback Rocky. And Rocky had a few skin issues, and as part of my examination I wanted to check his anal glands because I was highly suspicious that they were full. And I was not surprised with what I found. With squeezing the anal glands, I turned my back to the owner, who was standing at Rocky's head end and giving him attention, while I professionally and in a dignified manner started to squeeze his anal glands to relieve the discomfort. Well, I squeezed them and squirted myself in the eye, which was pretty gross, and I thought, oh no, now my professional dignity has been ruined. But thankfully the owner hadn't actually realized what I did, so I quickly took my shirt and I wiped away the anal gland juice from my face, and that stuff really stinks. And I told the owner it's quite stinky, but it's all done, and she hadn't realized what I'd done. So we went into the farmyard bathroom where she offered that I could wash my hands and clean up, and I thought that's great, but there was no light, there was no mirror and no towel. So I cleaned up as best as I could, but I was still smelling like an anal gland bomb. And then when I was done, I went back to the house and just summarized what we needed to do for her animals. And after that she said to me, gosh, you're right, that stuff really does pong, it leaves a great residual smell. Her thinking that it was still coming from the dog in the meantime, which was just coming in huge waves off my shirt.
After the break, Dr. Lisa finds out the extent of Saf's injuries. And is there any progress with Pisa the paralysed cat? What will Dr. Lisa and Super Sue find in the mystery box this week? And helpful hints to know when it's urgent to get your pet to the vet. Now fresh, 100% grain-free natural pet food for dogs and cats. Brought to you by healthypetfoods.co.nz for a healthier, happier pet. Saf is fully awake now, but Dr. Lisa is concerned about the state of her injuries and chats with her owner about what the best decision may be for her future.
So we've just taken x-rays of Saf, and we're really concerned. She's basically got a whole lot of arthritis going on in many of her joints, especially her knee. Arthritis, as you can see in these x-rays, is just these irregular protrusions in the joints. Instead of the joint having a nice smooth action, there's all these protrusions which cause it to catch, and with each step that she takes that's incredibly sore. And of course with Safi being so overweight, that's another really big concern, because all that additional baggage puts huge strain on her joints and makes it much more difficult for her to get around. And at a ripe old age of 14, it could be really difficult for her to come back from this. So I've talked to Jean and gone through all the things that we can do for her: acupuncture to help her pain, anti-inflammatories to ease the discomfort, various things to build up her joints like glucosamine, grapeseed extract, omega-3 fatty acids. And Saf's going to go home and Jean's going to see how it goes with her, and we'll just assess day by day and see how she goes.
Pippi's owner Jules is concerned that her dog may have swallowed a pill and has been not quite herself and acting off colour, so brings Pippi in to be checked over by Dr. Lisa.
You know the Tic Tac lollies?
Yeah.
It looked like that.
Yeah.
But before I could get it, she gobbled it. And I watched her all day Sunday, she was fine, but it's only in the last 24 hours that she's really...
Yeah.
After looking Pippi over, Dr. Lisa is confident that Pippi should make a full recovery from a minor tummy upset. Lisa now checks over the stray kitten that was brought in earlier to determine if she's in good health and ready to go out to one of ARRC's volunteers for foster care. It's time to meet our beautiful stray kitten's new foster mum, Buffy, a very compassionate little dog who's taken it upon herself to care and nurture all the stray kittens. This little kitty will be going off to one of ARRC's wonderful foster carers for lots of love and attention. And And what do we have in the mystery box? It's a heron! By the way, here's some interesting facts you may not have known about the heron. There are 64 different species of heron found inhabiting the wetlands around the world.
But often they get kicked out of the nest because they've got underlying deformities or fractures and things like that.
Here's something guys could learn from the heron. Both the male heron and the female heron help to incubate their eggs and feed the tiny heron chicks. Herons live for up to 25 years. Herons are not considered to be threatened or endangered animals, although concerns have been raised about the health risks to the world's heron populations. Pollution is a major factor in the decline of many animal populations around the world, and pollution in the water can have a devastating effect on the fish which the heron eat. Now for some helpful hints from Dr. Lisa.
Helpful hints for this week. So when do you need to take your animal to the vet? Well, the big question to ask, is it stable or unstable? A stable animal is breathing normally and rhythmically. The colour of their mucous membranes is nice and a beautiful pink salmon colour. An animal that's not stable often has a pale or congested red or even purple colour to their mucous membranes. The other things are they conscious and responsive? If they are, that's a good sign, but if they're not, they need to go to the vet as soon as possible. If they're vomiting profusely or bleeding relentlessly, those are other really important signs that they need to get seen as soon as possible. Phone your vet ahead of time so that they can plan what they need to do to get your animal stabilized as quickly and efficiently as they can. And another thing that you can do is take some rescue remedy or emergency essence just to take the edge off. Often it's good to have a dose yourself on your way to the vet. Well, I'm sitting here at the entrance to one of Tauranga's beautiful walkways around an estuary, and this is one of my favourite walks. It's so good just to escape and come out into nature and to see all the wildlife in their natural settings. In this area there's hawks and seabirds and herons and kingfishers, and it's great. But of course there's not necessarily any rest for the wicked. One time I was walking along the walkway and I spotted this little black shag. He was just sitting there sunning himself, but the more closely I looked, I saw that he actually had some fishing tackle attached to him, and the fishing line was wrapped around his wing. So I managed to get up close to him and catch him, and I found that 2 hooks had embedded in his skin, and they'd been there for at least a week, but this little guy had somehow managed to keep himself alive and keep himself going, and he let me unhook the hooks, and there wasn't too much in the way of long-term injury or anything significant to be concerned about. So I just released him and he went off and he flew away, and he was really grateful. It was such an awesome experience.
Go! Energy-packed natural food for dogs and cats, brought to you by healthypetfoods.co.nz for a healthier, happier pet. Dr. Lisa and her dedicated team are excited to find that Pisa the cat has in fact passed emotion completely by herself.
This is week 2. Little Peace has been with us for a couple of weeks, and we've had her being treated in our hyperbaric chamber and with acupuncture, all in the hope that we can return some of the function of her nerves and her hind legs back to normal. And we're really excited today because for the first time she's passed some poop. Yay! So she won't need an enema, which is wonderful, and this means that long term hopefully we can manage her and maintain her in good health, having quality of life.
This is a good sign and encouraging. Hopefully, with the loving care and dedication of Pisa's owners who have refused to give up, Pisa may just have a positive future ahead.
she's like how she is now for the rest of her life. I mean, we're going to be looking at getting her some wheels for the back end.
Yeah.
While Pisa's owners learn about the process of caring for their precious girl when she finally returns home, a little dog called Bella is calling for Dr. Lisa's attention. She has come in with a sore back leg and x-rays are needed to help determine what the problem is. While Super Sue rocks Bella gently off to sleep, ready for her x-rays, Dr. Lisa is about to find out some fantastic news. She has just received this success story from a client who had a cat who was seriously paralysed with a condition that's a mouthful to say called feline arterial thromboembolism.
Feline arterial thromboembolism, a real mouthful, but it's a condition that some cats get when they have underlying issues with their heart, and it's basically a blood clot that occurs in the lower half of their body, causing them to become paralysed. It's often a very painful condition and it can be quite difficult to get them to heal from it. So Sapphire came to us as a referral from her local vets who had done a wonderful job of helping her through, but in order to get her legs being used again, we wanted to make use of the hyperbaric oxygen chamber, and it's just worked wonders for her.
This is how bad the cat's condition was in the beginning. And this is how she's doing just a few weeks after coming home from the therapy and treatment by Dr. Lisa and her team.
This is an x-ray of little Bellatrix as we've never seen her before. It basically shows her pelvis with her hips coming down to her knees, and we're looking just to see if there's any underlying reason for her having lameness in her hind leg. And with x-rays you basically look to make sure that there's a nice ball and socket joint in that hip, and that there's smooth action and smooth edges with no roughened edges. And same thing with the knee joint, that being a little bit more of a lever action. It works in a different way to the ball and socket joint, but with her x-rays they're actually really beautiful. There's smooth edges, there's no roughened patches, and it doesn't look like there's anything on x-ray to explain the soreness of her legs, which is a good thing because hopefully we're just dealing with a soft tissue injury, which means just muscles or ligaments.
This guy is called Chance, a pit bull cross found lost in a forest in Rotorua, and the owners couldn't be found. He was in poor shape, but his rescuers gave him some wonderful TLC, and he's such a lovely boy. He's coming today to be neutered.
So this is Chance, and he was found by one of our clients in Rotorua as a stray, and they couldn't find his owners. They suspect he was a pig dog because he had these two big abscesses on his side when he was found, one there and one there. And he was so skinny, you could see his ribs, and his coat was dull and dry. But look at him now, it's a few weeks later. We've neutered him and fixed up his abscesses, and he's just looking amazing. Now the next step is to find him a fantastic forever home.
With a full-on day for Dr. Lisa, she still has one final patient of the day. Meet Cruz, who is desperately needing a tumour removed from his eye. Dr. Lisa and her dedicated team get Cruz prepped and ready for surgery with constant care to check how he's doing at every moment. This tumour has been causing poor Cruz major discomfort, but within a short space of time, Dr. Lisa has removed the tumour beautifully and Cruz's eye is neatly stitched up. As Cruz gently wakes up, he's taken back to his cosy bed in the recovery area, and this gorgeous chap can look forward to a brighter future now and looking at the world in a whole new way. Now here's something a little different that keeps the cycle of life going. Check out Dr. Lisa's worm farm.
Okay, so this is our worm farm. As part of our commitment to sustainability, we have a worm farm and a compost heap, and we recycle regularly. The worm farm is really helpful because we grow these worms and they thrive on our compost, and then we can use them to feed the baby birds that come in and the other types of species that eat worms like kingfishers and other ones.
series has been brought to you by ARRC Wildlife Trust and Bush Forbes Barristers and Solicitors, caring about the health of our animals and our environment. And by Healthy Pet Foods and Pet Curian. Good nutrition for a healthier, happier pet. Coming up on next week's show, can a hawk with an injured wing be rehabilitated and set free back into the wild? We check in on SAF's progress and what does Super Sue find in the mystery box?